Good morning, everybody. This is Aaron Mesh with Willamette Week. It's our Distant Voices interview series, and today I'm speaking with Rebecca Hicks. She's a pediatrician in Bend and is one of the signatories this past week on a letter to Governor Kate Brown calling for new measures to prevent the spread of COVID so that schools can reopen. The headline of those proposals, the one that caught everybody's attention, is that the letter asks the governor to close bars and in-restaurant dining rooms, and says that if that doesn't happen, there's really not much chance of schools reopening this entire school year. Rebecca, can you tell me how you got involved in this letter and why you thought it was important to send?
Sure. So thank you so much for having me, first of all. So I'm a pediatrician here in Bend, Oregon, and I follow COVID very, very closely for many reasons. One, because I'm a parent of 3 school-age kids, so it's really important to me from that aspect. And also for my patients, I want to know exactly what's going on so that I can take good care of them. So I'm sure that you can imagine and have heard that there are physician social networking groups. And so through one of those physician social networking groups, we were just chatting. Some Oregon physicians were having a conversation about what it's going to take to get kids back in school. So through that group, the idea of the letter to the governor was born, and we went from there.
What are you asking her to do?
So I want to be clear that we think that the governor is doing a good job, and that we feel like Oregon is faring relatively well compared to other states in the U.S. But what we don't think, what we're asking the governor to do is to put forward stricter measures. So we agree with the metrics that she's put forward to reduce community transmission, to have rates of community transmission be quite low in order for children to go safely back to school. But what we don't think will happen is that we'll meet those metrics unless stricter measures are put in place.
So what do you have in mind?
So we'll be sending the governor a proposal next week, and it's really multiple steps that we're asking her to take. The first step, the number one thing that we really need, is increased testing capacity. So everything begins at testing, because everything begins at knowing who does and who does not have the virus. And there is no perfect solution here. There are a lot of different test options, but we have to increase capacity in some way. So either through PCR testing or through more rapid testing. There's talk of in-home diagnostics, but those are going to be months away if it even happens. So we're not saying specifically what, but we are asking to push testing forward to increase funding so that we can really ramp that up. The second thing that we're asking for is an increase in contact tracing. And so this is partly where the bars and restaurants come in, because currently Oregon's stance has been that bars and restaurants haven't been the cause of outbreaks. But what we know is that we're not going to find that because it's not being looked for. So the way contact tracing is done, it's really challenging. And I feel for people in the position of being the contact tracer, because the general public doesn't necessarily want to tell you everywhere that they've been, right? They don't necessarily want to give all of those details. But as it is, the way contact tracing is done currently in Oregon is that people are not specifically asked whether or not they've been to a bar or restaurant. And if they happen to mention it, it's not recorded in some way that we could compare and see if lots of cases were cropping up from a certain place. So the first thing we're asking for is increased testing. The second thing is for increase in contact tracing capacity. We just need more warm bodies doing this so that they can get a more in-depth interview each time. And then the third thing that we're going to ask for is really the most important thing, and that's a drastic increase in public health messaging. So we know that we're not going to get through this pandemic unless individuals take their own behaviors with the interest of others' health and safety in mind. And so we really need to increase public health messaging, especially towards younger generations, to emphasize that each of them plays a very big part in this, and that we have to work together. Every Oregonian must do their part in order to get our kids back in school, to reduce community transmission. So that's the third step. The fourth step is as you mentioned, that we do think that bars, restaurants, gyms, and some other indoor social gatherings will probably need to be significantly reduced for a short period of time. But actually, I don't think it's a good idea to do that until we have the other steps in place.
I'm genuinely baffled that contact tracers aren't asking about bars and restaurants. I saw that in an Oregon Public Broadcasting story, and I was flabbergasted.
Yeah, I wouldn't feel that surprised, only because the contact tracers are doing what they can with the capacity that they have, and their major focus in these long, lengthy interviews with every positive case that comes up, their major focus is figuring out who they have been in contact with to prevent, right? So what the contact tracers are saying, well, you're infected, let's try to prevent as much more transmission from you as possible. So let me find out all of your contacts, try to get them in quarantine. So it's much more focused on prevention forward than it is on solving and figuring it out backwards.
Okay, that makes sense. So like they're really asking questions about who do you know who you might get sick rather than who might have gotten you sick.
Yeah. And if you can only do one, that's absolutely the right thing to do, right? To try to figure out who else you've been in contact with that may be in their incubation period, who needs to quarantine, so that those people don't then get other people sick. So if you can only do one or the other, they're doing absolutely the right thing. What we're asking for is to increase capacity so they can go both ways.
So what message do you think that people in their 20s need to hear in order to get them to essentially stay home and stay safe, given that there's a degree to which I think that a lot of people in their 20s, understandably, are taking a selfish view here. Mm-hmm. Something along the lines of, I'm probably not going to get very sick from this. It's probably not going to kill me. And you're only young once.
And I would even take it a step back from that and say that these people aren't being selfish, but what they're doing is called self-preservation. So people in their late teens and in their 20s and even in their early 30s, the focus of their life, the thing that gives them the best positive emotional well-being is being face-to-face with peers. And this is something that's in our anthropological heritage, right? Like, we know why this is so important to people, and the fact that they're being asked to isolate is super unfair. And other generations haven't necessarily had to do that. And this is something that's really hard for people who feel in their heart that the thing that makes them happy is being face-to-face with their peers. So instead of calling them selfish, I would say that they're just trying to do self-preservation. But I think the main message to get out to them is that we absolutely cannot do this without you. So we cannot get children back in school. We cannot get elderly people and vulnerable people and people with chronic medical conditions. We can't get them in a safer place to not experience things like bad disease and even death. We cannot get to that safe place until we have you guys on board, until we all do this together. And when we think about it as far as a sacrifice, because we are asking them to sacrifice something, right? When we think about this as a sacrifice, I hope that they can think of it as a short-term sacrifice, and that if we can actually all do it at the same time, it will be a much shorter amount of time than if we don't do it and just continue to drag this thing out. Because the reality is that there's no guarantee of an effective vaccine. I've seen some pretty good vaccine candidates, and perhaps we will actually have one, but there is no guarantee. But what we do know, what other countries around the world have done, is shown us a roadmap of how we can get through this without a vaccine. And that's using very simple tools like physical distancing, wearing masks, staying at home, especially if you're ill, but just in general, staying at home and not gathering when you don't need to. And then, these other public health tools of testing, contact tracing, isolation, quarantine, these are basic tools that are almost free, other than the testing and contact tracing that everyone can do. And this is the true roadmap to get us out.
So, on a more personal note, how are you holding up in Bend? You got 3 kids. It's almost, well, it would be time for school to start, but it won't. So how are things?
Things are hard. Things are hard. So, I'm a pediatrician. I do take care of some of my patients are quite vulnerable. And so I go to work and I take care of them and I worry about them. And I worry about the fact that these kids are not in school because so many of my patients need school, not just for academics. They certainly need it for academics, but not just for that. They need it just to be okay. They need it just to have a normal or somewhat normal, okay life. So it's been kind of hard for me because I go to work and I take care of these precious children who are not in an okay place right now. And then when I come home, sometimes it's hard for me to turn that off, to turn the worry off and just be a mother to my own kids.